weak support strength, shriveled hands, wrist pain or injury? In this video, I'll discuss the 4 hand muscles responsible for these issues. Hands are said to be the body's external heart, integral to movements of the fingers, wrist, forearm, elbow, shoulder, and even the entire upper body. Among the hand muscles, the palmaris longus, palmaris brevis, abductor digiti minimi, and abductor pollicis brevis are crucial. They support the wrist and help spread the fingers, preventing injuries to the wrist, elbow, and shoulder. These muscles influence wrist movements like flexion, extension, abduction, and adduction, making them vital for wrist mobility and stability. Connected to the upper arm bone, they aid overall upper limb movement and coordination, and determine the extension capacity and elasticity of the torso's front side. Together, they form the first layer of the hand. The palmaris longus starts at the inner side of the humerus and connects to the flexor retinaculum and palmar aponeurosis. This long muscle crosses the elbow joint and attaches to the humerus. Its function is to assist with wrist and hand movements. The palmaris brevis originates from the flexor retinaculum and palmar aponeurosis and attaches to the skin on the ulnar side of the palm. Its function is to assist with gripping. The abductor digiti minimi starts at the pisiform bone and attaches to the side of the base of the 5th finger. It is responsible for the abduction of the 5th finger. The abductor pollicis brevis originates from the flexor retinaculum, scaphoid bone, and trapezium bone. It attaches to the side of the base of the thumb's first phalanx. Its function is to abduct the thumb and aid in bringing the thumb towards the other fingers, as in a pincer grasp. The flexor retinaculum is a hollow area in the hand. While it's not part of the first layer, all the muscles in the first layer connect to it, and several muscles pass through it from underneath. When the muscles of the first layer of the hand are elastic, this area fills up, providing protection. If they become shriveled, the space decreases, restricting the wrist's movement and causing pain. The muscles of the first layer of the hand are all interconnected to the humerus. So, if you already feel a dull pain in your wrist or the base of your palm, or if your movement is restricted, it can lead to elbow injuries during physical activities. The wrist's range of motion depends on how open your palm is. The palmaris brevis, abductor pollicis brevis, and abductor digiti minimi muscles on the palm side help keep your hand open. If these muscles are tight, your palm can't fully open, limiting the movement of the extensor muscles on the back of your hand. This is why the first layer of hand muscles affects the wrist's overall mobility. You can see this in common hand gestures like the call me or shaka sign, and the span of your hand when playing the piano. The first layer muscles connect to the humerus, which then links to the shoulder, chest, and abdomen. When the arm is abducted, the torso extends. Observing the direction of muscle fibers, we can see that the pectoralis major and external oblique muscles run horizontally. When the arm is lifted to the side, as in a lateral raise, the deltoid muscle also aligns horizontally. If the first layer of hand muscles can't fully expand, your shoulder and other areas will take on more stress during movement, increasing the risk of fatigue and injury. For the same reason, the first layer of hand muscles determines the extension capacity and elasticity of the front of the torso. The body's elasticity determines its support capability, perfectly demonstrated by children climbing a door frame. As they climb, their palms open. The palmaris longus muscle engages, connecting to the humerus, which links to the shoulder, chest, and abdomen. This coordinated effort of the entire upper body explains why children, despite not being very strong, can easily climb up a door frame. Finally, if you want to learn how to train these muscles, watch the first part of this video by clicking here. The hands are full of interconnected muscles that work together to perform complex, precise tasks. In our next episode, we'll discuss the second layer of the hand. If you found our program helpful, please subscribe, like, and share. See you then.